the husband's family came to meet the girl's family and they asked for dowry. He turned around and said, it's a custom.
If we see women in India, they suffer through a lot of psychosomatic experiences.
The multiple roles that they are expected to play, because the assigned role is a homemaker. So they are always anxious.
How do you assess trauma in a more safer, non-intrusive way?
Mental trauma was something that अरे कुछ नहीं है, सदमा लगा है, थोड़े दिन में उतर जाएगा.
Welcome to the Samarpan podcast. I am Bhakti Joshi. I am a counseling psychologist and a trauma-focused therapist at Samarpan Mental Health, Mumbai. It is my honor to welcome an esteemed psychiatrist who has been in the field of psychiatry for the past 35 years. I welcome Dr. Anukant Mittal to our podcast. I would love to hear your introduction.
Thank you. Thank you, Bhakti. I am Dr. Anukant Mittal. I have been trained in psychiatry and MBBS at JJ Hospital in Bombay. Subsequently, I was in Switzerland and then in the UK in the NHS.
Yeah.
I have worked in the mental hospital, Thane, and then for 25 years, I was a professor and head of Department of Psychiatry at Kalwa.
Yes.
That is a Thana Municipal Corporation Hospital. I have been an examiner to more than about 1,000 psychiatrists and I have trained about 200 psychiatrists in my department and about 2,000 plus psychologists in my 25 years.
Yeah. So how do you feel looking back at this journey?
I would not say looking back, I'm still looking forward because every day, even now, you get unique cases, unique histories.
Definitely.
You learn every day.
Right.
But the past has taught me a lot, which the books or my mentors, my teachers could not teach me because obviously they were not exposed. And I've been learning from different cultures, different people.
Yes, yes. Interestingly, our topic is also going to be about the same in the Indian context. And I feel that the field of trauma is also expanding a lot in our society. So my first question is going to be that, what exactly is trauma in the Indian context? How would you define that?
I mean, the Indian content is no different. Trauma in every context would be the same. However, in the Indian context, in the past and currently over a generation, it has changed because the perception of trauma, the handling of trauma, and the support of trauma victims has changed because the family structures, the support systems have changed.
Right.
In India, the word trauma was unknown in field of mental health.
Right.
Because in India, trauma basically meant surgical trauma or that kind of physical trauma. Mental trauma was something that अरे कुछ नहीं है, सदमा लगा है, थोड़े दिन में उतर जाएगा, you will forget about it. It is only in the last decade, people who are cognizant, who are experienced, people like you, who have trained, have learned that trauma in mental health means a lot of things.
Okay.
It is an ingrained pattern of perception, cognition, and affects your self-validation, your self-confidence, your interpersonal relationships.
Right.
Because of the pain, distress that you suffered when you underwent that experience. In India, I mean even abroad, trauma was defined initially as post-traumatic stress disorder was a term, was specifically for people who had suffered life-threatening episodes of incidents which were beyond normal human experience. Now, I find it very odd because for a child who's grown up in a slum, watching somebody defecating naked on the railway is not a trauma. They're used to it. What a person who comes from a society where they've never seen a naked person, it becomes a trauma. So, socio-culturally, for each person, trauma means different things.
Right. Yeah.
Children who have grown up in families where physical aggression, verbal aggression is the norm, they don't perceive it as trauma.
And my next question will be about that itself, that when we are talking about types of trauma, right? So there is acute, chronic and complex. How does that differ in real life? Or is there a pattern, or is there a changeability in that? How do we view that or understand?
Very, very different. Acute trauma is an episode that happens, goes away, and leaves desperately clingy memories,
Yeah.
emotional and otherwise, in your brain. Maybe even physical trauma, signs, stigmas. Chronic is the worst
Okay.
because there is a precipitating event, there is a maintaining event.
Right.
So it keeps happening. And you can't get over it because added factor is anticipation of it happening, and it is validated that it has been happening. Your anticipation is not misplaced. कि ऐसा नहीं होगा कि कल नहीं होगा, पता है कि कल भी होगा.
Yeah.
So that added factor
Yes.
makes the trauma effects almost 100 times more. And that is the more difficult part to deal with.
Absolutely. And very well said, Dr. Anukant. I completely agree that there is a lot of anticipation, hence the trauma is always cyclical,
Yeah.
right?
Absolutely.
Because of which also there are some physiological responses which we sometimes term as somatic or psychosomatic experiences that are trauma related specifically, but people don't realize that. If we see women in India, yeah, they suffer through a lot of psychosomatic experiences. Can you shed a little bit of light on that?
Begin with a woman's role, her identity. I have had clients whose husbands, whose families, whose in-laws have been physically, mentally, emotionally abusive, who have been cruel,
Yes.
but they will still bear up with it because their identity does not exist unless it is juxtaposed and joined with the husband's identity.
Absolutely.
Because the moment the husband divorces or expires or leaves them and go, society does not treat them
Yeah.
as a person.
That's true.
So the first thing they do is they have to learn to bear up with the trauma because the loss of identity in today's Indian society
Right.
means a huge trauma in itself.
Right.
Right? And then, of course, you start with other things like money. Everything is controlled.
Financial
Even if
abuse.
she's earning, lady is expected to hand over the salary or earnings to the family or to the husband and has to literally beg for the necessities.
Right.
For the house, forget for herself. Right? So that is there. And the third thing is they are never valued. Their work in the house, their work in keeping up appearances, bringing up children, contributing to the family in every way is never counted, right? So they have to fight an uphill battle with all these things. In addition, if they are in a family which is consistently and persistently downplaying their attitude and actually causing them a lot of grief, it becomes difficult because there is no way that they can attain any level of self-validation.
What kind of common physiological symptoms have you seen which are trauma related but are brushed off as, oh, it's nothing new?
The first thing is sleep disturbances,
Right.
irritability, anger, lack of confidence, lack of self-worth, lack of initiative.
Right.
But primarily, what happens is there's a lack of sexual drive,
Okay.
there's a lack of interpersonal closeness relationships, even with spouse, even with children.
Right.
Because children follow the pattern that is there in the atmosphere at
Absolutely.
home. And of course, over a period of time, the anticipatory anxiety which persists through the day, it sets their adrenaline and their sympathetic system to a higher level. So they are always tense. They're always anxious.
Right.
They're always fearful. And this causes a big toll. This brings a big toll on their functioning in a day-to-day basis.
Right. Right. So how do you assess trauma in a more safer, non-intrusive way, when even respectful way, when the person is coming to you?
Well, the person normally would not come to me just out of the blue. They would come with specific complaints. With experience, within the first 2 to 3 minutes, you know that this is psychosomatic, it has got a lot of underlying issues. So you then gently probe into issues which help them value themselves, issues which devalue them,
Right.
and then start progressively moving into other somatizations that can affect their functioning. Like you ask about sleep, ask about appetite, ask about energy levels, about me time,
Yeah.
ask about hobbies, ask about interests,
The
ask
emotional
about
reactions. Yeah.
how do they react, right? And those kind of things. And then slowly the whole picture kind of unravels, and then you get a clearer idea of what is the underlying problem.
Yeah. India being a collectivist society, right? Everything is related to ये 4 लोग क्या कहेंगे? What will these 4 people say? Do you think that having gender norms, community support systems or groups, having a cultural background, having a gender specific role, do you think that impacts trauma related issues?
Absolutely.
Yeah. And in what
Absolutely.
way?
A recent study done by one of these social institutes in India had shown that almost 80% of the women who were working did all the housework. I mean, they would make breakfast
Yeah.
for the family. They would prepare tiffins to take to office and school, go to office, come back. And I mean, I for myself, having traveled in the local trains, have observed ladies, I'm talking 35 years ago,
Right.
sitting in the local train. I mean, obviously now there is no place to stand, forget sitting but ladies sitting and buying vegetables and sitting in the train, cleaning the vegetables, they're cutting the vegetables just because they want to save on time. When they go home, they have to cook because the family is waiting for food. The multiple roles that they are expected to play, because the assigned role is a homemaker and the provider is the husband. Now, it is not taken into consideration that they have started sharing the provider role. So, there should be some way the homemaking role should also be divided and shared.
Yeah.
Right? That is the primary. And then, of course, the income disparity. That is something that is culturally absolutely a no-go. A woman working from home who's got work from home is basically working and managing home like a homemaker, full time. There is no break for her, right? But the husband goes off to work
Yeah.
and he's off till the time he comes back.
True.
So there is no stress on him to manage home activity. Right? So these are gender or assigned roles that society has put forward as norms and which are ingrained into us. And it's very difficult to break the glass ceiling.
Right.
It also affects levels of official promotions, official activities, official recognition of your achievements. In addition, of course, there is the stress that, I mean, don't take me wrong, but women are considered weak. In fact, I mean, I admire the fact that, okay, even if they have their periods, if they're not well, I mean, when I used to work in UK, I used to see women walk in and say that they're feeling depressed and they can't cope and they want to get admitted. In India, I've never seen a woman come into hospital and ask for admission because she's depressed. She will not come in. She will have to be brought in by the family with severe depressive episode. right, with severe anxiety, severe OCD or whatever. She will manage the house. Even if she's got an OCD of cleaning, she'll sweep the house 20 times, but she will not seek help. It's not acknowledged. So there's no validation.
So I think it would be great to understand for our audience that how do Indian family system, play a major role in the trauma recovery.
Let me, for example, break it into two parts. One part would be you're talking of a joint family where you're having 2 or 3 couples living together with their children, so they can be supportive to each other, and there can be sharing of tasks during crisis, etc. That makes it easier if there is such an extended family or a joint family together. But in today's unitary families, unless there is a lot of support from the spouse, it becomes difficult, because any kind of therapeutic work that we do, any kind of pharmacological intervention we do, it has some effect on the person's daily activities, where somebody has to take up the slack. If nobody takes up the slack, the patient, the victim, has to continue as normal. So it becomes difficult for them. Even if you give them a home exercise or an activity to do at home or something, to find time, space, and motivation to do it, there has to be some backing. Right? So if it's a joint family, and if you're lucky enough that there are understanding people who support you, then it's excellent. But if you're in a unitary family, it becomes very difficult.
My next question is about the generational trauma. What does it look like in India, and how does it impact today's youth?
Today's youth believes in only one factor. Their whole concentration, focus is on I, me, myself, here, now, immediate. Instant gratification is their objective, is their driving force. I've had families with me with a young teenager, or not even a teenager, somebody in their early 20s, late 20s. And when the parents start talking about their generation and their struggles in coming to the stage where they are now comfortable, I have had many occasions where child as in their children, have turned around and said, you worked hard, you struggled, you suffered, so that we would not have a life like yours. Now that you've reached a stage where you can give us a comfortable life, then why are you cribbing? Let us enjoy it. That's what you worked for. Right? And they refuse to accept that across generations, there have been struggles, there has been trauma, right? And that itself causes problems. The second part is, if we take generational trauma as trauma that is carried forward generations, yes, we still have traditional systems, traditional culture, traditional norms, do's and don'ts, which are enforced. Recently, I had a lady who had come to me. She had fallen in love with a colleague. They were both in US. They were both earning in excess of about $200,000 each. And they decided to get married. And the husband's family came to meet the girl's family, and they asked for dowry. So when the father, within a minute of the demand, called up the girl, and she was waiting eagerly because she knew that the meeting is happening. And he said, this is what they're asking for. And her fiancé, so-called, was waiting with her at the time, and she turned around and asked him, what is this? Your parents asked. He turned around and said, it's a custom. So what's wrong? Now, it's a love marriage. It's not an arranged marriage. And you've been together for a year, you're living together for a year, And you turn around now and say that, yes, it's customary to give this huge amount of money. For what? For us signing a paper? So she immediately asked him to leave the flat that they were sharing. And she told her dad, throw them out. Just ask them to leave. Right? But this generational trauma, if she didn't have the guts to do that, right? The pressures of the culture, which carries across generations,
Right.
would have gone into her.
Okay. Yeah. So she would have followed the same.
And she would have then lived with that guilt. Right?
Right.
Okay. Her family would have suffered. Right? And this is what is happening today.
Yes. As a psychiatrist, what kind of unique challenges do you face when you're dealing with trauma within the family?
One of the major easier solutions, which previously we would never suggest or we would never hint or never explore, if the trauma was chronic, persistent, but increasing in terms of its intensity, in terms of its disruption, in terms of whatever, we would never discuss separation. We would never discuss. But now, more and more, we are hearing of grey divorces. People, even after marriage of 30, 35 years, are separating. But that is one part of it. That's a very, very small, minuscule percentage. But marriage as an institution today is become a very easy thing to get into and out of. The moment there is perceived or actual trauma, the first thought that comes is separation. And young couples who come for marital therapy or marriage therapy, my first question to them has changed over the last 10, 15 years. I ask them, when you are working with me in therapy as a couple, as a unit, tell me, is your objective to stay together and build, or have you come to me to help you move away peacefully? Because I have different approaches.
Right.
If you're wanting to stay together and build, I will approach it differently. If you're going to separate, then I will build a different plan and we'll follow that plan. So this is one of the things that we are facing now. But having said that, more and more people are now, especially in trauma, because people like you, I mean, I admire people like you who have worked in trauma, who talk about trauma, who help people with trauma proactively, has kind of opened the world where people are able to talk about their trauma
Yeah.
and seek help and work with themselves to help sustain the trauma, to stand up to that trauma, or in addition, deal with the consequences and repair themselves from within. To help themselves kind of unravel from the trauma they've had, the effects of the trauma. I mean, they will. My saying is very clear, and I have been at times criticized for it. You know, I tell people that if a child or a person, a female, has been raped, don't ever think she'll forget.
Right.
You are an imbecile if you think a woman who has been raped, a child who has been raped, is ever going to forget. That trauma is going to be there, the traumatic event is going to be there. How we help them is to develop mechanisms and tactics, strategies to cope
with it.
constructively with it. That's all we do. And that's what's happening in today's world. We see more and more people coming forward and talking about trauma that they had suppressed. Right? Even 40, 45, 50-year-old ladies are coming with trauma. People, men, are coming with trauma, history of trauma, childhood sexual abuse, which they never talked about, or they talked about and nobody paid attention to it. And they've carried that with them because they are male. And this thing does not happen to males.
Yeah,
And nobody believes them.
that is true.
Right? And now they're coming forth and saying, so we help them say that, okay, it doesn't matter if anybody believes or not. It has happened to you. It has scarred you. Let us work with how we can deal with it. And they're ready to do it.
Yeah, that is fantastic. I mean, I completely agree that more and more people are becoming aware that they need to speak about it. And it's very surprising that most of them have had a history which traces back to 20, 25 years to 35 years that they have been abused by someone that they trusted, and it stays with them even in their 50s and 60s.
True.
And
they've learned not to talk about it.
Yes. And also the important part where you said that male child sexual abuse is highly neglected in our society. And
Can I?
Yes.
Can I request you to use a different word than neglected?
Okay.
Suppressed.
Suppressed. Fantastic. Okay.
They actively, proactively suppress it. They don't ignore it.
All right.
Words are used was, ये लड़कों के साथ ऐसा नहीं होता, ये झूठ बोल रहे तुम, ऐसा कभी नहीं हो सकता. Because the concept of having sex or sexual assault on a male child is alien.
True.
They can't imagine it.
Yeah. Have you noticed any changes in the way trauma is presenting in India after pandemic?
The pandemic, actually, I'm writing a book on that.
Okay.
I call it the snap from the Avengers.
Okay.
He snapped, and when they undid the snap, the 5 years disappeared and people came back in time 5 years later. I think the pandemic is that.
Okay.
It is a snap. Suddenly children from preschool ended up in primary, from primary ended up in secondary,
Yeah.
from secondary ended up in junior college, senior college, graduate, and suddenly they ended up in jobs. They never had the period of interaction with others in that period of the pandemic. So it's like they skipped those 1 or 2 developmental years. In terms of your question, that 1 or 2 years, 3 years was a time when people were actually confined.
That's true.
And we have to remember that humans are social animals. So we need interaction with others. And especially in urban areas and working areas, we are used to being busy, moving, traveling, meeting, talking, discussing. And suddenly that came to a stop. So a lot of people spent time in introspection.
Right.
A lot of people started looking inward. They had a lot of free time to think. In addition, there was this fragility of life and death. You may get affected by COVID. You may die. If you get affected, where are you going to find a bed? Where are you going to get the drugs? Where are you going to get the oxygen? So all this uncertainty in many ways brought about a lot of time for people to think. And in that thought process, they uncovered a lot of repressed memories. And that's how it started coming out. Now, maybe they were able to voice it. They were able to pinpoint the trauma, the cause of the trauma. But many times they weren't. But what emerged was the emotional upheaval. So more irritable, more angry, more impatient, depressed, lack of self-worth. Because again, you're not going to an office where people validate your work, where people praise you. You don't meet people to laugh and smile and joke with. You don't go out. You don't go, don't out to eat, have a party. That is not happening. So there are no positive, uplifting things happening in your life. So the effects of the trauma that you suffered becomes more dominant.
Right. What does trauma healing realistically look like? And what aspects usually surprise our audience?
Trauma healing basically is one, accepting that there was trauma.
Yeah.
Two, absolution. Absolving yourself of all guilt that you had no role in the trauma. Ascribing blame and forgiving, because now you can't do anything about it, but not forgetting. Primary is not forgetting. Don't try to forget. You will never forget, because it is embedded in the memory circuits of your brain. It cannot be erased. What you can do is, each thought is accompanied by an emotion. You can help modify the emotion so that instead of having a negative impact, it helps you grow. It helps you learn and move on ahead. The most significant effect that people see is the change in the personality of a person as they start learning to absolve themselves. So they feel free. They don't carry the guilt. They are able to vent and talk about the event, so they feel lighter. And the third part is, they learn to be assertive about themselves, about their needs, about their wants. And that helps them the most.
Absolutely.
That is important.
Yeah. And that will also take a lot of time. It's not going to be...
Absolutely.
Yeah.
Depends on the resilience, the support systems, and please don't take it as a general term. It depends on the efficiency and the professionalism of the therapist.
Therapist, yes.
A person like you would have in your armamentarium techniques like EMDR, like cognitive behavior therapy, rational emotive therapy. You would have a lot of techniques that you could mix and match at different levels and work with the client. But an inexperienced therapist may not be able to interpret.
Yep.
And even if they interpret, they may not have the skills to put it. So that would also affect. But overall, once the client identifies the event, the trauma, whether it's acute, ongoing, chronic, and learns to deal with it, especially the anticipation part of it in chronic, ongoing stress, they begin to heal themselves.
Right.
And that is the most important thing, because nothing in trauma works unless the client proactively starts the healing process from within.
Yep.
And that is what is necessary.
Yes. Now, how can practitioners approach trauma in a more culturally appropriate ways without pathologizing the lived experiences?
Very difficult in India.
Okay.
My experience is that unless you tell the patient that there is something wrong, not with them, but something wrong that has happened, and they have to work with you to set it right, they will not do anything.
Okay.
Because they are so used to the passive acceptance and let it be, don't rock the boat. So unless you explain to them that the way you react, the way you do not allow yourself to feel proud about your accomplishments or to be assertive about what you need, they're not going to learn.
Yeah.
They're not going to benefit. So it is necessary for us to get them to understand that there is, not the word pathology, but there is something that is not right. That's something that needs to be addressed. And then the process starts that once you accept that something needs to be set right, you will begin the process of setting it right. If you do not let them to the stage where they understand
Yeah.
ki there is something that needs
To be addressed. Yeah.
they will not address it.
Yeah. Yeah. And also letting the patient or a client know that just because you have a diagnosis does not mean you are that. It's just
Right.
what you have gone through. Explaining them about that also makes a lot of difference in the therapeutic journey.
Two different viewpoints on that.
Okay.
Many clients love to talk to others that I am working with my therapist to deal with my trauma. And they often seek sympathy and help. I'm not saying they do it on purpose or whatever, but yes, they want to be, known that they are suffering from trauma or effects of trauma. In other cases, yes, as I said, if you do not use jargon, like I would look at culturally different people. And if I'm dealing with a person who's not going to understand the word or the meaning of trauma in any language, I speak different languages, but if they're not able to understand not only the word but the definition or the explanation of it, it is best to then work with the symptoms that they have come with, and you then start talking to them about addressing those symptoms.
Symptoms.
And that helps.
Right. Now, in what ways does the Indian understanding of trauma differ from the Western framework?
Understanding of trauma has two aspects to it.
Okay.
One is the actual understanding of the trauma, the pain, the suffering, the distress, the symptoms, everything that it causes. The second, which sometimes is one, is the insurance. The money that you get out of it. Because you've been given a label that you're suffering from stress because of trauma, you're a trauma victim, you immediately start getting disability benefits. Your medicines become free. You start getting house help. The council provides you with somebody to come help you with your laundry, to help you with vacuuming, to help you with your utensils, to maybe even help you with your cooking. If your children are small and you're incapacitated or you're disturbed with trauma so much, they would even provide you with childcare. So it means a lot in terms of supportive care, which they get. And I'm not saying this that you do it on purpose. I'm saying this also is one of the benefits of being diagnosed clinically as a trauma victim.
So when we hear about therapy modalities like EMDR, somatic therapies, cognitive behavioral therapies, internal family systems, dialectical behavior therapies, and many more, how do you decide which is the right fit for the particular client?
Surprising a person like you should ask that.
Yeah.
You are a multifaceted, well-trained in different modalities of therapy. When there is a lot of emotional dysregulation, lot of explosive outbursts, lot of emotional issues, interpersonally, you would probably use DBT. When you have a lot of background noise to clear out, you would use EMDR in the same patient. Right? If you are setting up goals to improve their life, to go ahead positively, you would work with REBT and CBT. You'd set up a heuristic
Yeah.
pattern, heuristic goal setting for them. So, in a same client, I mean, if I had to refer for a patient, I would choose a person like you who would at different times change the therapeutic approach, modify it according to the client's current needs.
Right.
So there is no one therapy that works. What is known, and this is Dr. Joseph Zohar from Israel, who is an expert on PTSD. And this was about 7-8 years ago. In an international conference, he was asked this question. He was talking on benzodiazepines and other drugs in PTSD. And he came out very clearly that all his research showed that no drug alone works in PTSD, in trauma. There has to be a multifaceted therapeutic approach in addition to pharmacotherapy, which will help control the somatic symptoms till the patient learns to deal with the stress and the emotional upheaval that causes the physical symptoms. That is necessary.
Do you think that traditional Indian practices like yoga, pranayam, meditation, or Ayurveda can be like a supportive therapies in trauma?
Everything helps. I can't say about Ayurveda, Unani, or homeopathy because I'm not trained. But yoga, meditation, the integral part to all these practices is you make me time.
Right.
That half an hour, 1 hour is your time where you spend it with I, me, myself. Whether I do yoga, whether I do mindfulness, whether I do pranayam, it is I who's doing it in my solitude. So that begins that you are claiming out of the 24 hours, you are claiming time for yourself to heal yourself. So it works.
How can a person recognize that they need trauma-focused therapy or psychiatric support?
Well, they need to see a psychiatrist or a psychologist, both of whom will determine
Right.
what is the level of distress and how deeply ingrained it is in the physical symptomology. I doubt any good psychiatrist, well-trained psychiatrist, would say, take these medicines, they'll help you. That's it. I guess, maybe I'm old-time, I love working with a team of people who... So I would definitely tell them this medicine will help you control your symptoms. But what has been underlying the volcano that is building up inside you, you need to have safety walls for it and you need to work with somebody to slowly vent out the steam. So I would refer them for therapy.
For the team, yeah.
And I think most of experienced therapists would know that at a certain level, there are certain physical symptoms which are not subsiding or which need to be controlled for their therapy to work properly, efficiently, would need to refer to a psychiatrist to start pharmacotherapy.
What are some trauma-related symptoms that Indian patients frequently overlook or misunderstand?
Isolation, poor interpersonal relationships, anger, change in activities, stopping all the activities that they had passion for, withdrawing from it, becoming quieter, performance at work, concentration going down, losing jobs. They'll always blame somebody else for their non-performance. Change in appetite, change in sexual behavior, change in sleep, and it's very common for us to say, "Arey, theek hai, he's growing older, he's sleeping less, theek hai, he's got stress at work," right? Those are the normal excuses which we give ourselves, but the underlying root cause is the trauma
Yeah.
and its cause.
Yeah. And addition to that also, when it comes to self-harm, active and passive self-harm and even self-medication for that matter. Like in Samarpan, we see a lot of clients who has taken support of alcohol or drugs to deal with their a lot of emotional distress. Can you shed a light about that too?
Patients who have suffered trauma early in birth or during birth are more prone to addictions. Like I said, you need medication to calm the
System.
upheavals in you. And most, if not all, of these patients are using drugs and alcohol as self-medication. They are self-medicating themselves because they take that, they feel relief, they feel comfort. More, they feel release from the stress that exposure of trauma has brought to them. So they are able to suppress it, repress it again. You know? So that is self-medicating. And that is where it is necessary for us to move in to help them. Us, I am including you and me, where I would help them wean off what they are addicted to, while you would work with them on developing strategies to cope with the distress without using medication.
So in India, how do we differentiate between trauma, anxiety, depression, and psychosomatic complaints, especially when many of the symptoms overlap so much?
Only by taking proper history. Nothing else.
That's true.
It's only by taking proper history. Listening. You listen to what they're saying. Right? And ask pointed questions. Right? Explore.
Yep.
Help them, not in a predatory manner or a intrusive manner, but help them uncover what they are scared to talk about. Because I'm sure, experienced person like you also, within the first 5 minutes of talking to a patient, you are aware that there is something going on which they are not ready to talk about. And then you have the skills to slowly help them, veer them, and help them to start talking about these issues. And once they start talking, then there's no stopping it. Because once the barrier is lifted, then it flows.
Right.
Then it is up to us how we regulate the flow, how we keep it safe, so the patient doesn't get overwhelmed with this uncovering of the repressed memories and doesn't go into a breakdown or an emotional shutdown. So that is what.
What should people look for when searching for trauma-informed therapist or psychiatrist?
So probably you need to find out first if that person, and you have to be, you imagine, I mean, I tell all my clients, this is my opinion on paper. Please discuss with your family, seek a second opinion.
Okay.
Then take a call. I say that same about therapists. Let them go to a therapist who's so-called trauma-informed therapist or dealing with trauma. Evaluate if you're being heard. Evaluate if you are comfortable. Evaluate if that person can empathize with you. Do you feel a connect? In the sense that the therapist is able to feel you, understand you. And then if not, move on to somebody else. Right? Because unfortunately in our country, we don't have any oversight committees or things even for psychiatrists or psychologists who will determine that, okay, you are an trauma-informed specialist, you are a EMDR specialist, you are a CBT specialist. All you can depend on whether they are trained by people who have got certification of training from the parent institution like Albert Ellis or Beck's Institute or this thing, unless you have that, right? But I have not yet seen a psychologist clinic where they put up these certificates,
Yeah. Okay.
saying that they're trained, right? So it's a trial and error.
What are some common myths around psychiatric medication in context of trauma-related disorders that you wish people understood better?
The first problem is not only clients, physicians, and sorry to say, even psychologists do not understand the difference between sedatives and hypnotics. For them, any psychiatric drug is sedative and causes sleep, while it is only the hypnotics that affect sleep. The other psychiatric drugs do not cause sleep, they relax you. And when you feel relaxed, you feel a sense of pleasant, relaxed comfort, which may slow you down. And if you have been tightly wound up so many days, suddenly if you find release, you may find yourself relaxed. The myth is that they're habit forming, they're addictive. Yes, some of the psychiatric drugs, if taken without supervision, are addictive. They have side effects. Yes, if taken in doses beyond prescribed for uses not prescribed, yes, they are harmful. Right? But the main thing is, I get patients who come back after 20 years. And they said, we've come back because last month we went abroad and we forgot to take your medicines. And they've relapsed. And so I look at them and I say, 20 years? You were taking medicines for 20 years without seeing me, without a prescription? Right? And I try to make them understand that if you would have kept coming back to me, I would have tapered the medicine and we could have given it a trial of going off medicine and seeing how things are. But the myth is that they are habit forming, they are addictive.
Right.
And they all cause sedation. They cause weight gain. Yes, some of them do cause weight gain. Some of them do cause sedation. Right? But not all. So that is the myth about drugs. That even physicians and other medical specialty experts, they carry it with them. Right? I have seen prescriptions by physicians, neurologists, everybody. They have prescribed low doses antipsychotic medicine because the patient is looking a little anxious and unable to sleep.
Any message for our audiences who are wanting to seek mental health therapy or even psychiatric consultations? And we have an amazing team at Samarpan Mental Health with specialized services, but are still shy to explore that aspect.
Well, there are many reasons for them not seeking.
Right.
Some may be accessibility, affordability, etc. But the prime thing is meet somebody once.
Right.
Look up. Now you have the choice. Look up the facilities, the services, the qualifications, the expertise. Visit once.
Right.
See if you're comfortable. See if you feel the empathy. Go ahead.
Yeah, and it's an investment in ourselves also.
It is always only an investment in yourself, which is overdue if you need it.
Yes.
And you need to do it because whatever the cost, if you're looking at 40 years, 50 years, 60 years of life ahead,
Right.
would you like to live with this problem which will keep growing?
Yeah.
Or would you like to get rid of it and grow more freely?
Yes.
That becomes
And even exploring support groups which we run almost every single day can also help in that journey, because there are people with lived experiences and moving together is the way forward, especially in recovery.
Support groups, unfortunately, is the most deficient service in India, and it is the most efficient. Like in Alcoholics A, Alcoholic Anonymous is basically a support group at a national level. It has proved the most effective for the maximum number of people addicted to alcohol staying off alcohol. To share your problems with somebody who has the same problem and learning how they deal with it, how they have dealt with it, how they have come out of it, gives you such a strong sense of motivation that I can do it if they can do it.
Exactly. Yeah.
And to share with them. A support group is an essential part of a therapeutic program.
Absolutely.
Right? You cannot expect people to work without others. Right? How will they know what they're doing is right or not?
Yes.
It's only when they share with others, they'll get an idea, okay, this is where I'm going wrong, I need to do this way. Or, okay, I'm doing this perfectly well. She did it or he did it and they benefited from it. So I need to persist with this. It'll take time.
Exactly.
So support group is an essential part of a therapeutic management program.
And I think that is what Samarpan is also uniquely providing
Absolutely.
in the same space with a lot of experience in the facilitation of support group and process group, and that is what makes Samarpan unique as well, right? And I would like to thank Dr. Anukant Mittal for presenting trauma in such a simplest terms for our Indian audiences so that they can avail and understand more about trauma and have encouragement to just seek out help, because like you said, it's long overdue. Thank you so much for explaining trauma in a simplest way possible, and I hope people have the courage to seek help for themselves now and stand up for themselves and choose themselves.
I hope this helps them get motivated,
Yes.
to get proactive and call to
Yes.
make an appointment. And that's the beginning.
Yes.
But thank you very much, Bhakti. It was very nice meeting you and very nice talking to you about trauma, subject which you know more about than me. But yes, it was a very pleasant experience. Thank you.
Yeah.